Hi, good morning, and welcome to our weekly update. My name is Matthew Wallace. I'm the Director of Public Safety for Brevard County, and I will usually sitting in there Don Walker, and he could not join us this morning, so I know I've got big shoes to fill, and hopefully we can make this meeting very productive. As we talked about many times, these meetings are extremely important so we as the county government can get information out to you, the citizens, so you can make informed decisions for yourselves and as we combat this virus and this pandemic. So again, and I hope this session will be very informative. We've got some special guests here today that we'll introduce here in a second, and we'll take it from there. So when you get older, you see as well as I could when I was younger. So joining us is Mr. John Davis. He is the Community Health Director for Health here in Brevard County. Mr. John Scott, Director of Emergency Management County, and leads us in the emergency management functions. Last week we had a representative join us from Health First, and we have Dr. Robert Beatty. Right, Doc? Awesome. He's an ER physician from the Stewart Health Group here in Rome. And also joining us, as she does, just provides tremendous support for these functions, is our very own and fantabulous Miss Jessie Ray. She's our social media specialist, and she'll be monitoring today's program for any questions that we may receive from the media and our viewing audience, and we'll work to address those questions when we get to the end of our update. And with that said, we'd like to start the update with Mr. John Davis from the Florida Department of Health. And Mr. John, sir, all yours.
Okay, thank you. Good morning. So another week, we're at the highest rate of infection we've seen so far during this pandemic. Last week, we had 1,000 cases, so that equated to a little bit over 1,300 cases per 100th population. This week, based on our numbers, we're anticipating that number will rise. I'm thinking somewhere around 1,900 per 100,000, which would put us above a 30% positivity rate. Those should be available at the end of the day today. Having said that, I mean, those are scares, but at the same time, I will say that over the last, we have experienced a daily case rate. And when you look at some of the other data that's out there, particularly the Canaveral sewage viral monitoring, that's dropped by half from when they last end of the year. We're seeing similar reports of in other East Coast cities such as Boston, New York City, seeing a drop in cases. So I'm hopeful that we're reaching the peak. Next week will be very telling, but early indications are we may have gotten there. That would put us in line with what South Africa experienced. They reached their peak about a month after they started seeing increases in caseload at that point right now. So I'm cautiously optimistic that we're close to that point, and hopefully we have a quick drop off after that peak. In terms of deaths, we thankfully have not seen an increase in our. They're certainly well below what we saw during. We're very thankful for that. Hospitalization. They've seen an increase across the board. However, again, with a more than the Omicron, the level of care has been more at the med-surg level rather than the ICU. However, most of our healthcare facilities with staffing issues, due to folks out with COVID. So those two things combined are definitely putting a strain on it. The same is true for long-term care facilities. We are seeing some outbreaks increase there, and they're experiencing staffing shortage as well. So that's certainly for us is monitoring those outbreaks in those high-risk operational settings. In terms of vaccination, we did immediately, but at least it's an increase. So we went percentage point. So at this point, we're at 69% coverage of our vaccine eligible population. So those five, a little bit more of a breakdown on our preteens. They're at 16% vaccination our teens are at percent of our population has been boosted. So again, we certainly folks that aren't vaccinated to seek vaccination. Those that have received series, encourage you to get. Certainly, again, the message we've hammered since the very beginning of is those common sense measures that we know that work. Vaccinate, masking in public indoor places, as well as social distancing, hygiene. Again, if you're sick, monitor yourself, and in a public setting if you're symptomatic. Schools, again, the community, so certainly they've seen a tremendous increase. And again, the saints there, we would encourage age kids, of course, those over to and again, if your children, keep them home from school. That's about all I have. The testing continues with our health department as well as various places throughout the county. That information is available online at our site, the county EM site. 211 that information as well. Our vaccination clinic is open, so we encourage folks to come by Monday through Friday, and of course, many other places throughout the nation. So again, it's not hard to find and lines at this point. So we again encourage folks to come in and get vaccinated.
Awesome. Thank you, John, for that update. And I like the words that you use, cautiously optimistic. So moving in a good direction, but we're not yet. So we move on to the most awesome director of Brevard County Emergency Management. I almost called you Dr. John Scott. Mr. John Scott, soon to be. He'll give us a brief update from emergency management. John?
Thank you, sir, and I'm far from a doctor, but I'm working. Again, my name's John Scott, I'm director for Brevard County. I'll hit on a couple things this morning. One, as you heard John talk about from the health department, testing continues to be widely available out the county. The good news here, last time we were here, we talked about wait times really being pretty high. A lot from a process standpoint to improve some things, so we've been able to cut wait times at a lot of the sites that we've partnered with down pretty significantly. Still will be some waiting, but it's not going to be the 3 hours it once was. So that's really encouraging news. Again, we are continuing to see a high demand scene, continuing to test a lot of people countywide. Just continue to go. We partnered with two, one at the West Melbourne Field of Dreams, the other being at Rockledge City Center in Rockledge. We know that the health department's doing it. We know that Parish also partnered on it as well. So those locations are up there and they're available for you to seek testing, as well as our pharmacies, our urgent care centers. I will also, just as a reminder, as you heard John articulate a little bit what we're hearing in the hospitals and what we'll hear from Dr. Brady here in a minute, just remind folks, hospitals are not where you go to get tested. Hospitals are where you go when you're sick and you need treatment, not there to test. We have other options for that. I'll also talk about the monoclonal antibody treatment that it continues to be available at Rockledge. I know there's continued frustration with the limited appointments that they have. Again, that's mostly driven, that is entirely driven by the high demand for those right now and the limited supply that exists for that across the country. So we ask that you continue to be patient, remind you that you need to be both COVID positive and make an appointment. There are no walk-ups for that. That appointment at the patientportal.com. The screen right there shows you how to do it in account and continue to look for appointments as they become available. We ask that you work with us on that. You can understand that the end is really dry, the limitations on those things. And then lastly, I'll just say, and again, build on what John talked about when we come through. Let's use those good we know works. We've got a cold front coming in, Starting next week, we know that often, we'll see an increase in just regular sickness as well. So just out of caution, while we're still in this high Omicron increase, stay home if you're not feeling well. And if you can't stay home, you need to work, wear your face covering, keep distance from folks, and do all of those good common sense measures that we know are proven. Matt?
All right. Thank you, John Scott. We appreciate that update. We are extremely fortunate to be joined this morning by Dr. Robert Beatty, who is the ER physician at Stewart Health Group in Rockledge, to give us a perspective of, from a hospital standpoint and from an ER standpoint, on how COVID is affecting us throughout Brevard County. So, Doctor, thank you for joining us this morning, and we really look forward to your words, and we'll turn it over to you. Thank you, sir.
Thank you. I think we can all agree that, the word unprecedented has probably been played out extensively in the media. But really, there's really no better word to describe what it is we're dealing with, not just on a nationwide level as well. To that end, we're seeing a lot of patients that are coming in with simply no ability to hospital process due to the staffing shortages that were mentioned previously. I'd also like to second John's comment about the emergency department for COVID. Mobile home tests can be used, and they do not cause added strain to the healthcare system. Fortunately, with this go-round, we are seeing patients, which is extremely helpful. It allows us to really render better and allow people to go home in a safer and less intense environment to, if you will, we are seeing a much lower acuity hospitalization rate, which is good news. We're also seeing a preponderance of infection in the younger population, typically patients in their 30s that have not received the vaccine. Nod to the fact that the vaccine, while it does not completely prohibit the infection from spreading, does confer a fair amount of protection to the severity of the illness, which really helps the community at large as well. So to that point, anything that people can do to remain good citizens, to isolate when we have illness at home or we have symptoms, if you feel this, to do so. Most importantly, mask up, make sure that you keep yourself isolated, precautions, and I think we're showing signs that this trend, at least of this variant, this surge, is kind of on the waning end of.
Awesome. Thank you so much. We appreciate you being here, and thank you. Okay, so that's most all the inputs that we have from the panel. Now over to Ms. Jessie Ray, our fantabulous social media expert, so we can address questions from the audience and concerns that y'all.
Awesome. Thank you so much. So I'll start with some questions from the media prior to. So I'll start. How many individuals at Stewart and Rockledge Regional are hospitalized? Do you have that number?
I don't have an exact number system-wide. I can tell you that in comparison to prior variants or surges, it's a much lower percentage of the overall admission volume at the hospital. I would say the vast majority of COVID admissions, if we're looking strictly at COVID, are good 1 or 2 night stays, usually in a med or step-down unit.
Okay, so they're mostly in the step-down units. You don't. Do you know how many you might have in ICU or how many are inpatient?
Exact data,
Sure.
but I could estimate it's probably upwards of a single-digit percentage compared to the overall hospital admissions.
Okay, great. And you kind of started to mention it. Do you know about how many hospitalized, vaccinated, or unvaccinated, and how to count vaccination status at Rockledge and Stewart Regional Hospitals?
So, already to count that data is probably much different than any other healthcare facility that's out there. There are several divisions of vaccination status, from those that haven't been vaccinated to those that may have only had one of the 3 series shot, or those that had the Johnson shot. So really the definition of vaccinated is tough to the actual numbers. Overall, I can say that those that are coming in with a higher acuteness are those that have been unvaccinated. So that's probably the...
Okay. I guess this could be for DOH. How are the case counts being affected by the recent increase in or John? Either John.
Well, certainly, I mean, the more you test, the more you're going to find that there's plenty more out there that we quote numbers. That's known positive results. So there's plenty more out there than that, and that's always the case with any disease. However, when you look across the spectrum, how many people are testing, you see the increase in care settings, outbreaks, the increased admissions. So it's just an indication that those numbers are truly up, regardless of how many you're testing in a day.
Okay. John Scott, does the county still have a supply of the monoclonal antibody treatments?
Yeah, and just to help clarify that, so we partnered with a vendor, CDR Health, who's a private health provider. They're the ones who operate that, and they get that straight from the state. So it's not the counties, but yeah, touched on the idea that it's limited. I've said that since we've been back with Omicron, as we know that nationwide has pushed that nationwide and continues to constrain our ability to offer as much as we offered during Delta. But yes, supply still remains. We are taking appointments, all those things.
Doctor, you kind of mentioned it when you were giving your update, but I did want to, Berman, maybe you have something more to add. What differences are you seeing in the current surge in cases from the Omicron variant compared with the previous Delta, such as the severity, the hospitalizations, that kind of thing? Was there any more you wanted to add?
So I would say that with the variant, and the challenging part of the specific pandemic is the virus itself. The variants that are really unpredictable, and they can range from extremely infectious to very minimally infectious and minimally severe. I would say that with this current, we're seeing a much lower acuity, the presumed current variant compared to Delta. The Omicron variant, at least in the South African studies and several other nations, lower acuity type of variant, and we're seeing that as well. The transmissibility, different ballgame when compared to the Delta virus. The Delta variant at the time was also hitting us harder in a period where fewer people had been. In fact, I think it probably encouraged a lot of people to, which may have contributed to some of the decreased presentation we're seeing with Omicron now. So it's a combination of low, higher transmissibility being blunted by the vaccinated public. So that's kind of where we are.
Okay, excellent. Thank you. Mm-hmm. And, I know, John, from DOH, we are cautiously optimistic, but Dave, you at all optimistic about the local outlook in light of the case count having peaked in some other parts of the country, other nations, which mentioned, or is it kind of too soon to tell? And do you want to add more to what you kind of said earlier in regards to that?
Well, we look at what the trends are around the country, around the world. We often look to Europe and certainly South Africa with the Omicron to kind of get a loose idea of what we might be looking at. Of course, that each population has a different set of morbidities, a different nation. One of the concerns was here, as opposed to South Africa, we have a much older population, a lot of comorbidities. So that was a big concern, that even if you're looking at a particularly mild or a variant, you have a higher risk population and a bigger population. So you're just going to have regardless, which that puts a strain on the health system. But answer to that is yes, I'm optimistic that the other data points in the community, like I pointed out, the wastewater load has gone down. I think it was 50% from when they last tested. So that's a good indication that we're headed in the right direction. And again, you look at the East Coast in general, it's like everybody's starting to trend. And again, to say we are at a peak today, but it's pointing to that. So I'm hopeful that that's indeed the case. We'll have a clearer picture certainly next week.
Okay, thank you. Okay, how do we take all of these home tests into account of the data that we're giving since they're not necessarily reported. We testing numbers, but we're not reporting those at-home tests. So are we how are we doing that?
No, so again, any numbers that we're quoting are documented positive. So some of the tests, such as the Binex home test, the app report that. So some home tests are reported, some aren't. So those that aren't, we would that in our database. I mean, of course, if a facility is used, we as a health department get a call from that facility that they have positives on that. But of showing up in the data necessarily, unless that's sent to us with all the information on the positive, then it can be loaded. But percentage of home tests do have that capability, and they will upload into a system that reports directly into our.
Okay. And so kind of speaking at-home tests, I think most of us know about the at-home tests that the president put into effect. How are people supposed to go about getting those tests?
Yeah, I'll take that one. Again, we know there's been a lot in the media out there as far as when that's going. We know the president's talked about it several times. I think most recently he said there will be a website that comes online sometime. Obviously, as soon as that information is out there, we will share it far and wide. Today, that's not something that we're optimistic that that's going to be an option for folks next week. Feds tend to move a little slow on things. So it'll be 2 weeks, but I know they're January.
Awesome. So the appropriate masks to wear has gotten a little bit confusing over, can any of you provide any information or simplify people be purchasing and where?
Well, I did hear a quote in the media. It was from Dr. Job, who is up at Brown University and is on the news quite a bit. And it comes right when he says that is one you're going to wear all day. I mean, that's the bottom line. Certainly, 95s are effective than a cloth mask. However, a cloth mask is effective, and it more down to wearing it properly. The biggest message. I mean, we can get into studies on which one might be a little bit better, but the bottom line is wear it in the appropriate settings.
Okay. Do you have anything to add?
So I'd kind of second that as well. 95s are going to obviously provide protection for the person wearing the mask, but more importantly for those that aren't. Should be noted that a proper N95 requires sealing, requires really verification. It is actually not particles in or out. But to that point, any reduces the transmission of the and decreases the trajectory on exhalation. Is going to be best served whatever is consistently worn.
Okay. And also to that, like you said, there's a lot of frauds out there, such as Amazon and things like that. Any recommendations as to where people should invest, like maybe Home Depot or Lowe's or anything?
Not really,
Okay.
to be honest with you. I mean, ironically, painters' masks is adequate of a protection as a low-level N95. So as long as you have decent protection, and again, appropriately isolating yourself from other people, combination of behavior-specific barrier transmission that overall provides the effective reduction in transmission.
Right, and I think that's one thing we've been talking about a lot ever since we started this, is it's not just one mitigation factor, it is all of them are what's going to help us, mitigate this. It's not even just stop it. So, a couple of people asking, and I don't know that we're going to have a definite answer, put it out there. If a test taking a flight or it's on the, provider.
I'll take it. And the short answer, Jesse, is what you think, which is it depends on where you're going, what the care requires, what the provider requires, domestic travel on a plane doesn't currently, I'm sorry, a test. Foreign travel does, depends on that country you're going to. Best is if you're going somewhere, just would, when you're making plans to pack and who's going to pick up the mail and all the kinds of things, also do research on what's required to get into wherever it is you're traveling. And a reminder, if you are traveling, wear a face covering
on your flight. I did have one thing out in the comments that somebody said, don't read your comments. And you're right, we don't read your comments, read your questions. And so I did want to just solidify that. The questions that we have for today. So back to you.
Thank you, Jesse. And that kind of wraps it up for our weekly A. I'd like to thank all of Brevard County tuning into this. Thank you for sharing 30 minutes with us this morning, so we can get that information out to you, so you can make appropriate and good decisions for yourself and for Brevard County government. Our sole purpose is in support to the community. So this is part of that vehicle that we use to provide information and support the community. So thank you for tuning in for this. A big thank you, big shout out to Dr. Beatty. Thank you, appreciate you being on the panel. Big thank you to John and Jesse and the man behind the scenes upstairs, Logan. Those four their tails off for a better part of 2.5 years now. Facebook's go out to work to just do everything. There's a tremendous logistical effort to make these things happen, and folks behind the scenes, and they don't get a lot of recognition from time to time. So I can just thank John, Jesse, Logan, thank you guys, and Dawn Walker, who's not here today. Thank you guys for making this happen. It's tremendously important that we get. And I know as a Brevard County citizen, and I appreciate you guys as part of my county government. So y'all have a great weekend. Thank you again, Brevard County, for tuning in. Please be safe out there. Please use the information to make those good decisions. We will see you next week. Next week, we're a bit of a different time. We're going to be starting at about 2 p.m. in the afternoon. On our social media and our ties for this session. Again, it'll be starting about 2 o'clock in the afternoon, 2 p.m. next Friday for our next weekly COVID update. Y'all have a great weekend, and again, thank you for tuning in.